The chemotherapy unit here is a newly developed unit. You can see there's concertina doors that retract back to create two larger shared unit. Within the units there's air conditioning units, rise recliner and TV, and it's got French doors that open out into courtyards. The treatments we provide here is a range of chemotherapy regimes, immunotherapy, targeted therapy through various different routes: intravenous, subcutaneous, intramuscular and of course oral chemo.
In July 2020 I was diagnosed with breast cancer in my right breast. A lot of the treatment I had here at the Oaks. The thing I liked about having the treatment here was the continuity of care. So every time I came in for a treatment, I would see the same faces. I got to know the nurses really well. They were really friendly and lovely. I felt very supported whilst being at the Oaks. The consultants are fantastic, they're very knowledgeable, and the nurses too. The fact that I could see the same ones every time, it became a very familiar environment, which was very comforting during times that are very, very challenging.
So One Stop Clinic is aimed for patients with suspected cancer. So if you take an example of a breast One Stop Clinic, it involves the patient seeing the breast surgeon, having a mammogram, ultrasound and a biopsy on the same appointment, so it's one stop. The key here is about trying to have quicker and faster access to cancer services. We provide diagnostic services as well as surgery. Patients have one-to-one care with a consultant. There's discussion of patients in multidisciplinary meeting, and patients have treatment which can be offered in the dedicated chemotherapy unit at Oaks.
Patients can access treatment through our designated specialists and fast and at their earliest convenience. At the time of the appointment, they can also access the diagnostic tests on the same day. We know it's a worrying time for patients and their families, and I'd like to be here as a point of contact to answer any concerns and questions that they may have throughout their treatment, and also to let you know that we can offer an anxious patient pathway.
When I would meet with my doctors, I never felt rushed. There was always plenty of time to chat through any questions that I had. I really felt listened to and felt that I was really valued, not just a number.